Quack quiz time. Left untreated, diabetes is responsible for a whole host of nasties, including kidney disease and vision problems and much more often heart disease. You may think that diabetes is a disease that only your gran gets, but spoiler alert, it's one of the fastest growing chronic diseases in the world and no one is immune. We spoke to Kerishnie earlier about heart disease, but it turns out that the prevalence of type 2 diabetes for South Africans of Indian descent is much higher than in the rest of the population. So given your pharmaceutical and ethnic background, I'm going to venture a guess that you're going to score really well on this particular quiz. Not so?
I hope so.
I'm sure you will, Kerishnie. And I hope you've done the quiz so you can compare your score to Kerishnie. So here it is, question 1 of 10. Where in the body is the hormone insulin made? In the liver or the pancreas?
Pancreas.
Absolutely. Beta cells in the pancreas. Pre-diabetes is considered what? A reversible condition or the onset of lifelong diabetes?
Reversible condition.
It is reversible, thank goodness for that. It's a condition also known as impaired glucose tolerance, and it's an early yet potentially reversible stage in the development of type 2 diabetes, which is great. You don't have it, you can do something about it. Third question, eating high sugar foods on a daily basis can result in type 2 diabetes or weight gain.
Weight gain.
Oh, that was a trick question and you got it right.
Weight gain, it's a myth.
With such confidence. It is a myth. You were saying it's a myth, that?
It's a myth that if you eat sugar every day that you will get type 2 diabetes.
You're so right.
Or diabetes.
I mean, it's weight gain all the way, especially around the belly, which increases your diabetes risk. And as Kerishnie said, just because you have high blood sugar doesn't mean you eating a lot of sugar is what got you there. It's more about being overweight than any particular food you eat. So, question 4, so far 100%. Having diabetes puts you at 4 times greater risk of what? Stroke or heart failure?
Stroke.
Right again.
Come on, that's
amazing,
easy.
Eh? In fact, as many as 2 out of 3 adults with diabetes also have high blood pressure, and uncontrolled high blood pressure is one of the major risk factors for stroke. In fact, they say that if you have high blood sugar at the time of the stroke, the damage is even more severe. Fifth question, if someone refers to you as being a hypo in diabetic terms, what would they be referring to? You being anxious about your health or you feeling faint, dizzy and hungry?
Faint, dizzy and hungry.
Don't confuse it with hypochondriac, it's hypoglycemia and needs sugar quickly. For every 2 hours spent watching TV, how much does your diabetes risk increase? 5% or 14%?
For every 2 hours spent watching TV,
your diabetic risk increases by 5% or 14%.
Believe it or not, I'm aware that with South African statistics, your diabetes actually increases by 20%. So I would lean towards 14%. Heart disease, you're at a risk of 14, well, actually 15% for South Africans.
Okay, so you know too much.
So 14%. I'll go with 14%. Wow.
It is 14% indeed, and that has to do with inactivity, of course, eh? Not how much TV you watch. Wow, 100% so far. What is polydipsia? Is it the feeling of dizziness, you know, when you get dipped in dancing, or excessive thirst?
Excessive thirst.
In fact, an interesting little fact there, the body tries to counteract high blood sugar levels by sending a signal to the brain to dilute the blood, which obviously translates into thirst. Which of these is an important risk factor for type 2 diabetes? Binge drinking or drinking alcohol after exercise?
Binge drinking.
Binge drinking, of course. Eh? This is
say
impressive,
of course?
You're just getting everything right. True or false? People with diabetes are more likely to get colds and other illnesses.
No, it's false.
It's false.
It's false.
It's another trick question that she got right. That's amazing. It's true. It's false, rather. No, it's true that it's false. In other words, you're no more likely to get a cold or other illness if you have diabetes. However, people with diabetes who do get the flu are more likely than others to go on to develop serious complications. Yes. 9 out of 9 so far. This is for 100%. Besides heart disease, final question, and stroke, having diabetes also increases the risk of developing breast and colon cancer or skin melanomas.
Breast and colon cancer.
100%. That is amazing, Kerishnie. That is a first. Congratulations. You're so right. In fact, if you wanted to know, a large review has found that patients with diabetes had around a 25% increased risk of developing breast and colon cancer.
Tell you, my gran had diabetes and unfortunately died of colon cancer.
Kerishnie, thank you for being part of the show. Thanks for getting everything right. 100%. I bet none of you did better than that. Well, there might have been 1 or 2 of you, but well done. Look forward to having you again on the show soon.
Thank you very much, and well done on a brilliant show.